Cervical spondylosis, commonly known as neck arthritis. It is a degenerative condition caused by the wear and tear of the bones and cartilage in the neck. But what's driving this multi-billion-dollar market? Hi, I'm Dr. Harvey TRAN, CEO and co-founder of Evergrowth Biohealthcare Capital. In this video, we'll talk about the new medical trends on the diagnosis and treatment of cervical spondylosis. Welcome to this week open mic webinar. Here, I'm going to share with you a recap of the summary of what I presented to members of our team. First, I went over the definition of cervical spondylosis, and this is basically a degenerative condition that is affecting the cervical spine that is causing the wear and tear in the cartilage, disc, and bone in area of the neck. Cause for this condition is due the wear and tear is related to age, and as such, it will be more common in older adults. But for younger patients, it could be due to a traumatic injury like a whiplash accident from motor vehicle collision. It can cause like injury to the bone or to the cervical spine in the neck, and then when it heals, it will tend to have osteoarthritis in that region. I discussed about the type of cervical spondylosis, and this include the cervical radiculopathy, cervical myelopathy, as well as axial spondylosis. Now, myelopathy is when there are compression in the spinal cord of the neck. Axial spondylosis is basically characterized predominantly by pain, mainly in the neck itself, and then cervical radiculopathy is when you have pinched nerve in the cervical spine. So when you look at this cervical spine right here at this region, there's this nerve that coming out here. So when this nerve is pinched due to damage of the bone right here, then it can cause that cervical radiculopathy. Also, you can have the spinal cord compression here as well. I also then discuss about the global prevalence of this condition, that millions of patients worldwide are affected by this condition. This condition is more prevalent than you think, and with the global population expected to live longer, that there will be a rise in cervical spondylosis. Here's in this chart, it shows you the estimated market size for cervical spondylosis. Currently, at 2023 last year, market was at roughly $6 billion and grown at 6.3 CAGR from now to 2031. You can expect that to reach above $7 billion, so quite a significant market. For diagnosis of this condition, I discuss about physical examination, imaging tests, as well as electrodiagnostic tests. Diagnosis, like most conditions, start with a physical exam. Doc would do like neurological exam and assessing for the sign and symptom. And next step in the diagnosis is order with the imaging, X-ray first, then to more complex imaging like MRI or CT scan, and then there are also other electrodiagnostic tests that can be done that include the EMG, also nerve conduction study. For new medical trend, I discuss about regenerative medicine like stem cells, minimally invasive surgery, as well as advanced imaging technology for early diagnosis. Nowadays, like the innovation, we'll be focusing on minimally invasive surgical procedure like robotic surgery, also regenerative medicine like the use of stem cell treatment, PRP, and also the development of more advanced imaging technology that would allow for earlier diagnosis. A common medication to treat this condition is like just pain medicine with NSAID like ibuprofen, Tylenol, also muscle relaxant for patients who experience muscle spasm, also corticosteroid to reduce inflammation in the area. There are also new medication being explored in this niche, biological agent, as well as neuroprotective drug, or drug that is protective to the cervical spine. New medication include like a drug that would be used to reduce the inflammatory process, as I shared with you. Also, neuroprotective drug that are designed to protect the nerve that come out of the spinal cord, as well as the spinal cord itself. Last part of the call, we discuss about a company to invest in, and there are a couple of interesting companies that we discuss. Despite the limited room for innovation in this niche, there are several companies that could present as a promising investment. If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen. He's a cardiologist, also medical director, and he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector, and in knowing so, I can fine-tune my research position and invest in young innovative company before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.